Hello everyone. In this webinar, I'll be dealing with step 1, which is about identification of problem, reviewing data, formation of a team and writing an aim statement. Whenever we work in a given system, we have resources like we have infrastructure, material, drugs, and we work with those resources to get the outputs in terms of delivery of services and client satisfaction. Despite best of our efforts, problems do exist in any given system. In order to know how our system is working, we need to ask two questions. What is being done in the system, and that is called content of care, and how it is being done, which is known as process of care. Then afterwards, we do a gap analysis by mapping the process. By this, we can identify the areas that have problems which need to be fixed. To do this objectively, we need to review data. Now, how to review data? So, we take a hypothetical situation for that. Let us see, in this labor room record of a district hospital, when we review this record, we can see there are important protocols that are to be followed. Like, all the women who deliver here should receive uterotonics within 10 minutes of delivery. All newborns should be immediately dried. Delayed cord clamping should be done in all the cases. But are these protocols being followed for the cases? With the available data, we can observe that out of 10 women who delivered in labor room, only 5 received uterotonics within 10 minutes of delivery, and only 70% of neonates are immediately dried. Delayed cord clamping was done in only 80% of cases. So, we can see that once we review our existing data carefully, we learn that many problems are existing in the system, but we cannot change everything, and therefore, we need to prioritize and find out what we want to change. So, the next step is to make a list of whatever problems you identify in your system. Quality improvement is a new skill for many people, and it is useful to think of the first improvement project as an opportunity for learning. It is helpful for new teams to work on those QI projects which are simple, easy to fix, which do not need too many resources. The project which you choose should have some value for the patients. The problem should have a fast turnaround time so that you can get the results quickly, because success keeps your team motivated. Later on, gradually you can work on more complex long-term projects once you have built stronger skills in using QI methods. To prioritize the problems, we have a tool called prioritization matrix. When we have multiple problems to work, we can measure each of them on a scale of 1 to 5 in terms of some characteristics like how is the problem important to the patients, how affordable it is for us to work on, or is it easy to measure, and if it is under control of the team members. Accordingly, we gave scores to all these issues, and then a total score is calculated for each issue, and one with the highest score is chosen for working. So now, once you have assessed your situation, you have made a decision to work on a particular problem, you need to plan a project, and for that the most important step is selecting your team. Now, when we are choosing our team members, the team should have people who are directly involved in that work which needs to be changed. Team members should preferably be volunteers who are intrinsically motivated, enthusiastic and wanting to bring the change, and it is also a good idea to keep somebody who is also influential so that he can get the things done for your team. When you are selecting your team, be inclusive, including the members from every level, right from cleaner to administrator, and also from all the departments who are concerned in the process. One of the members amongst the team should also be assigned the role of a team leader. The team leader should have skills of getting more like-minded people together, should have patience to listen to everyone, and should be skilled enough to solve logistic issues. Yes, the team leader need not necessarily be the most senior person, rather than it can be anyone with above mentioned skills. The number of members to be included although varies depending on the project which you undertake, but it is advisable to keep the members in the range of 5 to 8, as too many members may be difficult to manage and too less may get exhausted and thus reducing the efficiency of the team. Teamwork is important because the healthcare system has multiple range of people, and as a team, when different range of people are involved in a work, it gives an opportunity to everyone to identify and generate better ideas and more newer ideas. This also improves uptake of any solution and reduces the resistance to change. And of course, when we achieve something together, it increases confidence of every team member. Now let us learn how to write an aim statement. Writing an aim statement is basically a description of a team's desired outcome, which is expressed in a measurable and time-specific way. An aim statement should be clear, specific and linked to specific patient population. It should include a goal and should neither be too difficult nor too long to achieve. It should also include a solution. Now, how to check whether your aim statement is good or not so good? For that, there is an abbreviation called SMART, where S stands for specific, M stands for measurable, A for achievable, R for relevant and recorded, and T stands for timely. An aim statement should have all these components. There is one more way by which you can see the completeness of your statement. There are certain questions which you should be able to answer. Let us see an hypothetical example. Suppose your team picks up a problem that there are many central line associated bloodstream infections in medical ICU of your hospital. The statement they write is to reduce the incidence of central line associated bloodstream infections in medical ICU of hospital from 30% to 10% in next 6 weeks. Now let us ask the questions. Who? That means which patients will be benefited? The answer is that patients who are admitted in medical ICU of hospital will be benefited. What? What means what is the outcome? Outcome will be central line associated bloodstream infections. How much? The amount of desired improvement, that is from baseline rate of 30% to less than 10%. And by when? Time over which change will occur, and that is mentioned as within 6 weeks. So, we can see that all these questions are very well answered in this statement. Now, I give you some more example to see the adequacy of your aim statement. First example is to increase the compliance of proper biomedical waste disposal in Department of Surgery. So, do we think this is a good aim statement? No, because it does not specify who will be doing it. It is not measurable and it does not have a clear-cut timeline. Therefore, the SMART aim should be to increase the compliance of proper biomedical waste disposal among doctors in Department of Surgery from 80% to 100% in next 4 weeks. Let us take another example. Hospital will have 75% of their employees vaccinated for hepatitis B. Is this a SMART statement? No. This statement, although is specific, achievable and relevant, but it is not measurable and timely. So, correct statement should be hospital will have 75% of all of their employees vaccinated for hepatitis B from current level 20% over next 6 months. With this, now we have learned step 1. We will now proceed to step 2. Thank you.